September is National Atrial Fibrillation Awareness Month, so this makes it a good time to recognize the signs and symptoms of AFib, which can lead to stroke and heart failure. Mindy Prouty is a board-certified nurse practitioner who specializes in cardiology at Virginia Mason Franciscan Health's St. Michael Medical Center in Silverdale. Welcome to New Day.
Thank you for having me. It's also National Advanced Providers Appreciation Week. And so we want to say hi and thank you to all of our APPs.
Oh, amazing. Yes. Hello and congrats to all of them. What is AFib? We got to start there.
Yeah. So atrial fibrillation is actually the most common irregular heartbeat that patients can develop in the whole world. And so it's really important for patients to be aware of the signs and symptoms of it. Atrial fibrillation is essentially when the top chamber of your heart and the bottom chamber of your heart beat completely out of sync. So the top chamber of your heart actually starts to quiver and the bottom continues to try to beat normally. And the risk of atrial fibrillation that we talk about the most with patients is stroke, because you can develop a blood clot in that top chamber of your heart when it's just quivering, and it can be pumped out of your heart to your brain. So really important to be aware of atrial fibrillation.
Yeah, and are there any signs or symptoms besides a stroke leading up to it that we should be looking for?
Yeah. Very commonly, our patients will come in and they'll say, I have been feeling like my heart is racing, like I have palpitations, I feel short of breath, I feel lightheaded, or I feel weak. Or they can have chest discomfort. But it's really important to also recognize that sometimes these symptoms gradually occur over time. So you don't always have to have a really fast heart rate. You can just over time start to notice that you can't do the things you normally like to do without feeling short of breath.
Gosh, okay, good to know. And we hear a lot about new devices like smartwatches that check for AFib. Would you say that these are accurate, though?
So smartwatches and wearable devices are very helpful tools in the diagnosis of atrial fibrillation when you pair them with different symptoms. So if someone brings us their readings from a smartwatch or a portable EKG device, that's a helpful tool to understand. Maybe you've had AFib at home. They're not always 100% diagnostic. So you always want to talk with your doctor if you're experiencing signs or symptoms of atrial fibrillation along with those irregular readings from your smartwatch.
Okay, so don't fully rely on those devices. Come and actually speak to an expert in the field. What treatments or lifestyle changes should people with AFib be aware of?
Well, atrial fibrillation really commonly occurs in patients who use excessive alcohol, who are obese, have physical inactivity, who have high blood pressure that's not controlled, and very commonly in patients who have untreated sleep apnea. And so atrial fibrillation can occur in all of those patients. So if you think about your lifestyle changes, you want to make sure that you're exercising every day, that you're reducing your alcohol intake, and that you're having all of those underlying things that could be going on treated and evaluated by your doctor on a regular basis.
Yeah, do you have any practical tips then for people at home? You're always hearing or at least I am, 10,000 steps a day, Mediterranean diet, anything like that you can tell us?
Absolutely. So we recommend 150 minutes of cardiovascular exercise where you're exerting yourself every week, making sure that you are not drinking a lot of alcohol, making sure you are quitting smoking, and eating a really healthy diet. So, those are things that you can do to prevent atrial fibrillation from happening, but there are also things that we tell patients to do after you have a diagnosis of AFib to avoid those triggers.
Makes sense. Why is this month so important to get this awareness out to people?
Yeah. This month is really important because, patients who have atrial fibrillation are at 5 times a higher risk of having stroke, 2 times higher risk of developing heart failure, and 2 times higher risk of developing dementia. And so it's really important because it's so common. And so we want people to be aware that if you have these symptoms, you should be evaluated by a clinician.
Yeah, absolutely. Okay, any other key takeaways that you feel like you need to leave our viewers with before we head out today?
Yeah, absolutely. Number one, if you have these symptoms, see your doctor. Get regular checkups. Number 2, embrace technology. Make sure that if your smartwatch is telling you you have AFib, really look into that and be self-aware to know, am I having these symptoms or is something going on? And then check with your doctor. And number 3, I would say, adapt to a healthy lifestyle. So you should exercise and not drink a lot of alcohol, and be aware that atrial fibrillation is not necessarily curable, but it's treatable. And so you can continue to live a long and active, healthy life as long as you have appropriate treatment.
I love hearing that because I think sometimes when you get a diagnosis or you hear something like that, like AFib, you're like, what now?
Yeah.
But the fact that you can treat it and do all of those things is super helpful.
Yep.
Amazing. Thank you so much for sharing all this information with us
Thank
today.
you for having me.
Perfect. And so for a free heart health assessment and information on upcoming free youth heart screening events, including one this Saturday with Virginia Mason Franciscan Health and the Seattle Kraken at the Northgate Iceplex, just visit the website that you see right there on your screen.
New Day Northwest is sponsored by Virginia Mason Franciscan Health.